Thyroid issues in older adults. In this video, I'll discuss differences in symptoms, treatment, and diagnosis. There are many unique aspects of thyroid problems in people over 60. This is our topic today, as many of you requested it. First, thyroid issues become more common with age. That's not to say kids or teens can't have them. Thyroid problems can occur at any age, let's be clear. So why does the frequency increase? Often, thyroid issues are chronic, requiring lifelong treatment. So what happens? The odds of having thyroid problems at 70 increase over time. But it's not just the elderly, okay? Now, about symptoms, what are the differences? I'll discuss the two most common thyroid issues, hypothyroidism and hypothyroidism. When the thyroid doesn't produce hormones properly. It's the most frequent hormonal disorder, affecting up to 10% of older adults. It's incredibly common. 1 in 10 might have it. There's something called underdiagnosis. Many cases go undetected, so the actual number is likely higher, making it even more significant. Let's start with symptoms of the most common issue. Hypothyroidism, where the thyroid doesn't produce enough hormones. What are the symptoms in older adults? Often we suspect thyroid issues when a patient's existing condition worsens. For instance, previously controlled blood pressure starts rising. Say you're 75 with great blood pressure and suddenly it increases. Why is that? Sometimes thyroid hormone changes, both low and high, can affect blood pressure. Cholesterol changes are very common. A person might have had normal lipid levels their whole life. Annual blood tests always showed normal results. Suddenly it increased by 50 to 60%. Thyroid hormone can cause this too. Low thyroid hormone can raise cholesterol, blood sugar levels can change, diabetes was controlled, then blood sugar suddenly spiked. This could be a sign of thyroid hormone changes. The same applies to blood pressure. Both high and low thyroid can affect blood sugar. Always remember, memory can be affected too. The patient's becoming very forgetful. Forgetfulness is one of the most common symptoms. When talking to patients during diagnosis, this symptom is reported almost 100% of the time. It's rare for someone with thyroid issues, especially hypothyroidism, not to mention increased forgetfulness. So before considering rarer causes of forgetfulness, always check if it's not a hormonal problem. Mood changes can also be a consequence of thyroid issues. Any disease that appeared later in life or worsened, you might have had it before. If you don't know why it got worse, always evaluate thyroid function. So I ask you, do you have any thyroid issues? Where in the world are you from? Share your city, state, and region where you're watching from. Also, if you have thyroid problems, when did you discover them and what happened? Did anything get worse? Did your cholesterol increase? Did your mood decline? Or did you become more forgetful? Leave a comment below. I read them all and love to respond. I want to clarify that thyroid problems aren't normal at any age. I've heard this many times before. Oh, I have a thyroid problem, but isn't that normal? The body adapts, the thyroid just slows down. It's common, but not normal, okay? You need thyroid hormone for your body to function properly at all stages of life, got it? So don't accept it as normal, because it's not. Other symptoms like constipation, cold intolerance, you're always having issues now. Weren't you fine before? A change in patterns, weight gain. But they said thyroid isn't related to weight. Why is this controversial? Once you're on hormone treatment, weight changes can't be blamed on thyroid issues, as the hormone corrects that. But with hypothyroidism, diagnosis often shows 2 to 4 kilos of weight gain. That's the average. Much of it due to swelling. In medical terms, it's called non-pitting edema. It tends to be firmer. It's different from swelling caused by a weak heart or heart failure. But it's something to watch and investigate. Weak nails, hair loss. So watch for these symptoms, which are more common in older adults. Regarding hypothyroidism, there's a significant difference in the elderly. Why? Because its presentation often becomes a separate chapter for older patients. There's a higher frequency of what we call apathetic hyperthyroidism. What are the symptoms of hyperthyroidism? How does it typically manifest in young adults? With agitation. In the elderly, even with excess thyroid hormone, they often become more lethargic. They become more apathetic, hence the name. This information is hard to find online. Even when I diagnose hyperthyroidism, Patients are often confused. They never suspect it because the patient isn't agitated, but rather more sluggish, so you feel more fatigued. Another symptom is weight loss, so you lose weight and feel unwell. These symptoms are more common in the elderly. Diarrhea, increased body heat, heat intolerance, these weren't normal before. Skin changes, possibly resulting in dry skin. A key issue for the elderly is changes in heart function. An elderly person might discover atrial fibrillation and arrhythmia. Check if it's due to increased thyroid hormone levels. What's the main cause of death in the elderly? Cardiovascular diseases. Always closely monitor thyroid function, as it often affects heart health by increasing thyroid hormones, which can lead to arrhythmias. As I mentioned earlier, thyroid issues should always be considered and evaluated. And here we have hyperthyroidism. In people over 60, a condition called toxic nodules is common, where the patient has an enlarged thyroid with many hormone-producing nodules, which becomes more frequent as the patient ages. Another common cause is Graves' disease, an autoimmune condition where the body attacks the thyroid, increasing production of an antibody called TRAB, which binds to the thyroid and causes uncontrolled hormone production. I didn't mention the most common type of hypothyroidism, an autoimmune disease called Hashimoto's thyroiditis. It's also a condition where the body produces autoantibodies, in this case anti-TPO, and another called anti-thyroglobulin, causing inflammation and impairing thyroid function. Fulfill your role? Produce hormones properly? Regarding treatment, are there any differences? There are several, but first, if you haven't liked the video yet, please do so. It's really important. As a thyroid specialist, I've searched but found no videos specifically about thyroid disease in the elderly. You often request this info, so please like this video. It helps me and boosts distribution. So what are these differences? One main difference, as I mentioned, is at the start of treatment. Young people typically tolerate higher doses of thyroid hormone, levothyroxine in this case. For the elderly, we start slower and gradually increase the dose as needed. Why? Often, if an elderly person takes a high dose initially, it can affect other systems like the heart, leading to various symptoms. This impacts treatment directly. I've spoken with older patients who refused treatment because they felt worse when they tried it. They'd say, "I felt worse." They experienced hyperthyroidism symptoms going from hormone deficiency to excess, so we must be cautious and start slowly. That's a key difference. Older folks don't tolerate it like younger ones do. Start slow to avoid hormone excess symptoms. For hyperthyroidism, we prefer starting with meds to reduce thyroid hormone production. Finding the cause is crucial as it may alter the treatment approach. Did you enjoy this video? What score would you give it? 0 to 10? I made this video differently, as a conversation without a script. If you liked it, comment if you want more videos like this. Don't forget to subscribe if you haven't already. Hit the bell icon and select all notifications. YouTube will notify you when I post new content. Now, I'll leave a playlist for you to watch right here. There you'll find everything about thyroid issues, common changes, thyroid tests, dangerous symptoms, tips for hormone users. You need to be careful with this type of medication. In this playlist, I cover all of that. Take care.